But what we are not taught in medical school is much about perimenopause and menopause.
No one is.
Yeah, I know. And
you
weight
guys don't
loss.
even talk about it.
We don't even talk about it.
I mean, it's literally like a 30-minute section in your medical school.
Yeah, and it's written by a man. So it's women go through menopause and perimenopause, and they're going to be hysterical. And your job is just to tell them it's fine and give them an antidepressant and move them along the way.
That is the craziest shit
No, I know.
I have ever heard. You're
Yes.
actually taught that.
Yeah.
Welcome to the Collective Mic, the podcast where women leaders get loud about what really matters. I'm your host, Joyce Tody, founder of Collective Women's Leadership. We are not here for fluff. We're here to lead, build, and rise together. Whether you're climbing the corporate ladder, building your own brand, or redefining leadership on your terms, this mic is for you. So let's get into it. I am so excited you're here today. Today I'm speaking with Dr. Tsui, Harpreet Tsui, like chop suey?
Yes.
Is that the joke?
That's the joke.
That's the joke. I got it right. So I've known you about a year. You joined Collective Women's Leadership through another colleague of ours, which is fantastic. Got to know you. An amazing sense of humor. I want to know more about your practice and kind of who you became as a doctor, right? As a woman coming up through this. So just walk us through a little bit about Dr. Tsui.
Yeah. So my husband and I moved here in 2008 for residency. So we did internal medicine residency here at Valley Hospital. And for the first probably 10 years of my career, I was an employed physician in multiple private practices, hospital clinics, all of those things. The pandemic hit, and that's literally when everything changed. When I was growing up, I went to my family doctor. And, you would go to your family doctor. They had their own office. Your parents would call. You'd get in the same day. They knew everything about you. That is always what I wanted to do. But as a woman, I never really thought that I could do it. All my doctors growing up had been men.
Oh.
All of my general.
No women.
Yeah, no women, right? Doctors as a family doctor.
Where'd you grow up?
Orlando, outside Orlando, Florida. Okay. Yeah. And so I thought, well, now or never. The pandemic really kind of opened up my eyes to where medicine was going. And that was kind of the time where it was like, either you jump now or you're not going to jump.
Sure.
Yeah.
Well, I do think that happened for so many people during the pandemic. All of these things started happening, right?
Yes.
And I think the more and more I talk to women and figure out what happened during this pandemic, we're all blossoming now. All of us as grown women who were leaders in our own right, accomplished in our own right, maybe in something else, finally had the courage to rip the Band-Aid off and do what we always wanted to do.
Oh, 100%. My husband was running the hospital, so that was just insane. I left a clinic. I joined a private practice. I was there for about 6 months. And Joyce, it was literally 6 months into it. I remember going, well, I could do this, and I could probably do it better.
Of course.
And I can do it on my own terms. And my kids were growing up, right? My kids are young and elementary age, 8 and 11. And so they needed me around. And I wanted to build a life. I was sick of being an employee and somebody telling me how to practice medicine. That's not why I went into medical school. And so that was really like 2022, August, when I opened my practice from November of 2021 to August of 2022, I was like, I can do this. I can do this, and I will figure it out. I have figured out a lot of things before.
You've done hard things, right?
I've done hard things.
Yeah. So you decide to open your practice. So tell us the name of your practice.
Yes, my practice is called Coronado Health Direct Primary Care.
Yes, here in Henderson, Nevada.
Yes.
And what were the early challenges you faced? Because we all have these delusions that we can do it and we can do it better.
Yeah, here's the thing. When you go to medical school, you learn all about the medicine, but they don't teach you anything about the business.
That's
because
right.
the idea is that they want you to get out and just become employed, just become another employed physician, right? And then like the CEOs of the companies can reap the benefits. And so I thought, okay, well, I come from a small business family, right? So my parents, when they opened up a business in Florida, we still have that business today. I saw my mom and dad like really just lay it down and figure it out. And I thought, you know what? I've got that in me to do it. I had a lot of support from my husband. But can I tell you, I did not know how to run a QuickBook. I was like, I know what that is, but I don't really know what that is. I didn't know how to charge patients. I didn't know how to get business insurance. I mean, just the most simple things. Like the medicine part was so easy, but the jumping in to how you actually get a business. What's a business license? How do you do this?
How do I lead a team?
How do I lead a team?
How do I interview a front office staff?
In fact, I only just got a front office staff about 3 months ago. I was doing it all by myself for the first 2.5 years.
Oh, my goodness.
Yeah. So
It is fascinating about doctors I speak to and attorneys I speak to are not taught anything about business in your professional degrees.
not at all.
At all. Dr. Michaela Tozzi, I
Yeah.
remember when she was first opening her practice, she would call me and say, how do I interview? How do I have these tough conversations with people who aren't treating my patients right? So it is fascinating. And I think people don't understand
No.
that if you're an attorney or a trained doctor, right, or a medical doctor, you all are taught squat about business,
Nothing.
which has to make it really hard in terms of when you do want to jump out and go on your own, because I didn't know the system was set up to just put you as a cog in a wheel, right? Just continue the...
Yes. So, but the thing about it is because I had decided to do it on my own and because I opened the kind of practice I did, it gave me so much flexibility to do the learning and the growing while I was in the clinic working.
Right.
Right. We had a really small space. I mean, trying to find a space in the summer of or the spring of 2022. There were like
That's a
no
mess.
small spaces open.
That's a
There was
mess.
so much we had to learn, so many people I talked to. And the interesting thing is you'll go to like a big bank and you'll say, this is what I want to do. And they have this assumption of what a doctor is. And they'd be like, you don't meet that criteria. You don't have this amount of revenue. Your bank accounts don't have this much money in it. We do not want to work with you.
Oh,
And yes, and so you start to
I didn't know that was...
it's
again,
a thing, yeah. And so
Sure.
you start to lean on the locals, right? You start to lean on I really leaned on the women that I had met in the 10, 12 years I've worked in Henderson. I've only really ever practiced in Henderson. So it was just cold calling old patients of mine, women that I had met at lunches and talks, and people that work at banks and say, how can you help me? I really don't know what to do. And I think the beauty of female entrepreneurship is that women are there to help other women.
That's right.
And I really think that's the reason why I was able to really leave a practice in June of 2022 and open my doors August of 2022.
You hit on something really important, right? Collective Women's Leadership was founded on that. I truly think founded on mentorship and helping women rise.
Yeah,
But you get in what you put in.
100%.
And we forget that. Sometimes women can sign up for something and then they're like, oh, it really wasn't for me. But did you show up to anything?
Yes.
Did you make connections? Did you take advantage of all of the opportunities that were laid out in front of you? Did you talk to a stranger? Did you cold call, right? Things that you have to do in order to level up in anything that you're trying to do.
100%. But I do think that some of that comes from the idea that women should be a certain way. And when women are not that way and women step up to the plate,
Right.
it
Yeah, we
scares
gotta-
other people.
Of course. Yeah, other
Right?
women sometimes.
Yeah, and it scares other women. And so we can get to this later, but that's why mentorship is so important to me. I mentor so many female medical students because I tell them this is what I've been through and these are the challenges you're going to face and let's do something about it.
Let's do something about it. So you've shifted the model. So the model and what sets it apart. So can you explain a little bit about direct primary care to someone unfamiliar with this model? Because I do think we hear this, right? Concierge medicine, direct primary care medicine. And a lot of people, when they hear concierge, they think that's way too expensive.
Yes.
Like, how could I afford that?
Yes.
And I try to, I want you to break down how they should take it seriously, why it is beneficial, and just break that down for someone.
In a traditional model, you get insurance. Your insurance dictates either who you can go see via an HMO or you can go see anybody without a referral, a PPO. So you call you go, hey, it's September 1, I got insurance. I'm going to find a primary care doctor in Las Vegas. You call 7 offices and everyone's like, it'll be 3 months, it'll be 6 months, it'll be 9 months, right? We don't have enough primary care physicians for the amount of people that live and are moving into this town. So you look at other ways to do this. Now, from a doctor's entrepreneur side, working in a traditional fee-for-service practice, one thing I don't think a lot of people understand is you are told how many patients you must see. You are told the time limit. You literally do have 15 minutes. You have to meet all these metrics based on the patient's insurance. Everything needs to be documented. It's a lot of work. So me, as an internist or an internal medicine doctor, I don't get the time to go through everything. Direct primary care takes out the middleman. We take out the insurance.
Okay.
So when you come to my office, you pay a flat fee. If, let's say, your high deductible health plan has a $1,000 deductible for you and your family.
Okay.
You can go to a direct primary care office. You pay that flat fee, which is always cheaper. So the 12-month total will be much cheaper than what your deductible would be. In our direct primary care offices, we do blood work, we do imaging, we do EKGs. We have resources to help patients save money, but every appointment is longer.
Right.
So in my office, every appointment, the first appointment's 90 minutes. Every appointment after that is 45. If you need to text me, text me. If you need an email, email me. If you need an emergency appointment because of XYZ, please come in. I can see you today. Can you come in tomorrow? It is truly that old time.
I love that.
Yeah, the way that medicine really should be.
Sure.
Right? You're not going to call your doctor and be like, oh, gosh, I broke my arm. And they're like, well, that'll be 3 months.
Right.
You're like, no, I think I need to see you now.
Right. Yeah.
And I think in this kind of changing environment where, again, I work with a lot of entrepreneurs and they're traveling and they're, here and then they're there. And so the ability of them to reach out via text and say, hey, I'm in New York and I had this thing happen. And I'll say, don't go to the urgent care. Let's get on a FaceTime. Let's just kind of figure out what's going on. The beauty of that is I've been told it's like I'm a doctor in someone's pocket.
Right. I love that.
Yeah. I would say the only difference with concierge is usually more expensive. And they usually, 99% of the time, will also bill insurance. So when you go in, there's a copay. Mm-hmm. But in direct primary care, we don't even want that. We don't take insurance whatsoever in the office.
But you do run labs through the insurance.
Yes.
And you do run x-rays, all of the scans or specialty doctors that they would have to go see or have services done, those are run through insurance.
Yes, and if you don't have insurance, let's say that for some reason that you're out of insurance due to job or you chose not to have insurance for whatever reason, we have cash pay prices for labs. We have imaging centers that we work with, and it makes it a lot easier. And even a lot of people who have insurance would rather go that route. And I really think in this day and age with medicine, and maybe because I'm also in that age group of women between 35 and 55, a lot of us are going through a lot of things. Right. And so you need to be able to call your doctor and be like, is this normal or is this not? And it gives it that beauty. And also I would say, especially to our older community, we have a lot of 65 and older patients in the community that need a little extra level of care, someone really watching over what they're taking, what's being done by their specialists, what medicines that they're on. My older patients know that they can come to me and they know that I'm going to go through everything line by line, bring all of your medicines. I will always make sure everything's right because somebody needs to do that for them.
Well, I'm speaking on a personal level, right? My mom is older and she comes from that generation where all these pills were thrown at them and they believed the doctor in front of them.
Yes.
And that is what I'm so happy when she decided to sign up and come and see you, because I think that there is a generational, the greatest generation and the baby boomer generation were raised to believe their doctor. And we have this unfortunate circumstance that's happened where they were given a prescription pill on a prescription pill on a prescription pill, not knowing that other prescription pill is for the side effect of the other. 100%. I get really passionate about this because I've seen what it's done to family members.
Yes.
I've seen what it's done to loved ones in terms of all of these prescription pills, because the doctor sees you for 5 minutes and says, here's your prescription, and they go on out the door.
Yes.
They don't even know the patient.
Every patient that comes to my office, I tell them this. If you come in and I say, Joyce, I'd love for you to do this treatment. And if you say, Dr. Tsui, I just don't know. Okay, let's sit down and have a conversation. Come back in 2 weeks, think about it, and let's go from there. I will give you the pros and cons. Everybody always knows. Because the other thing I tell people is this. I see you X amount of time in a year. You're out living your life.
Right.
So, if you end up somewhere and you need something, you need to be able to tell another doctor, my doctor put me on this because of XYZ.
Right.
And so I'm very passionate about that polypharmacy and the older generation. I really, really love my geriatric patients. And I think it's really important. And I'm glad that I get to do that in a way that also allows me to run a business that allows me to have the life that I want.
Right.
Yeah.
And you're so personable. So I have this question because I think you're lovely and your bedside manner is so approachable and warm and friendly. That's not something that's taught.
No.
That's something that's just who you are by nature.
Yes. When I got into residency, I thought I wanted to be a hospital doctor or do a specialty like cardiology or endocrinology or one of the other ologies. And halfway through my residency, I said, I really love speaking and talking to the patients. And I remember going to my program director and saying, I think I want to be in the clinic. And he said, you'd be a really great fit because you are so personable. And I think I've always been that way. Like I'll go up to anybody and start a conversation.
Yeah, of course. Yeah.
I'll call anybody and say I need help with something. It's just who I am. I really love what I do. It sounds so corny. I really love what I do.
Now that you're
happy. These last 3 years have been the best 3 years of my life.
Wow, that's fascinating.
Yeah.
With the challenges, trials, tribulations of opening your own business, which I find awesome.
I feel like the challenges and the tribulations make the effort so much more worthwhile.
Sure.
There's like a joy of putting the key in the door and turning it and being like, this is my space.
The joy of the struggle.
Yeah.
Yeah. It is fascinating. And I do think the younger generation now looks at us as these like glamorous women.
Yes.
And nothing we've done is glamorous. No. Nothing we do today is glamorous. I just put something out about that today because people are like, oh my gosh, it must be so great, right? To be a doctor and own your own practice or be an entrepreneur and like run this women's group and open another company. There is nothing about any of the climb that's glamorous.
Come and find me when I'm cleaning the toilets in my office.
Right.
Right. I do it all.
And there's no hack.
No.
And I'm so sick of influencers on social media telling the younger generation, try this hack to do this or try this hack. It doesn't work.
No, it does not work. And even people have come to me, colleagues have come to me and said, how did you grow your social media? And I say, it took me 3 years.
Yeah, it's a lot of work.
It's a lot of work.
Yes, it's consistency. It's showing up when you don't want to.
Yes.
It's saying some things that are probably going to be looked at a little awkward.
Yes.
Right? It's putting yourself out there. But that is the name of the game in any type of business, right? You have to ruffle some feathers and take chances.
100%.
Period.
100%.
Yeah.
And I would say in 2021, if I was sitting here with you, I'd be like, no, Joyce, I can't do it. It's too hard. I can't do it.
Oh, same. I was in the same boat.
Yeah. I just was like, there's just no way. I'm going to hire someone to put my whole business together.
Yeah.
And then.
Right. I'll just hire. Yeah.
I'll just hire someone.
Yeah, we could just hire
I'll get a
someone.
hack. We'll hire someone to do it.
We'll do a hack. Yeah.
But to do it on your own and be there,
different.
It's so different.
Yeah. Patient experience and impact. So you've alluded to this is extremely important to you, which I appreciate. Walk us through what it's like to become a patient at Coronado Health, right?
Yes.
So I become a patient. And from the initial contact to the appointment and follow-up, kind of what is your philosophy and how do you work?
So we make it really simple. We schedule free meet and greets. So everybody gets to talk to me for 15 minutes, kind of see what it is that they want, what I offer. Everyone's on the same page. When they're ready to sign up, they move up, they go through the link, they sign on. I call them. I say, hey, these are the available dates. I try to make everything as easy as possible. One thing I find, even as a patient myself, is I do not like going to the doctor and then sitting there for 30 minutes filling out paperwork. Like, I detest it. So what I do is make everything an electronic signature. You're going to get your new patient packet. You sign it. But if you can't, if it's too hard, come to the office and I'll walk you through it.
Yeah.
The first appointment's 90 minutes. Bring anything that you have that you think is significant to the conversation that we're having. The first 90 minutes, it's not about metrics. It's not about figuring out what the plan should be. It's who are you? Where have you come from? Where is your medical history? What are your goals? I say to patients, any doctor can give you quantity. Any doctor can make you live longer.
Yeah.
Not every doctor can give you quality of life as we get older.
Right.
And so the first appointment is let's lay it all down on the line. What do you feel comfortable with? Where can we go from here? And then it's about every 2 weeks I'm meeting with patients initially till we get everything done, blood work, imaging, anything that needs to be done, let me go through it. Then we come up with a plan together. It's a really open office, which is really nice. Like, I'll tell you, I just had a patient walk in today, texted this morning and said, I'm about 5 minutes away. Can I come in? Yeah, come on in. I've got some time. So it's that kind of homeliness of an office.
Yeah, come in.
And it's all about the patient, right?
Yeah.
It's I'm the doctor and I have the education, yes. But I'm never going to say, take this and leave my office.
Right.
It's a patient-doctor relationship. I'm very much centered on the relationship. I love this town. I love this city. I want all of my friends to live healthy and have quality of life so we can all have fun and do stuff together. And I think it's really important. It's really important.
And I don't think those of us in our generation even knew what that was.
No.
I mean, I think you alluded that you had it in Orlando. You had your family doctor, which was really great. But if you moved a lot or had different doctors or really were never sick and you only tried to get in if you needed like a Z-Pack, right, or something. But other than that, you weren't going in. to see the doctor?
When I was in medical school, I remember trying to get a doctor's appointment. It was so hard. I waited 6 months for a doctor's appointment in medical school. Just for I thought, I should probably get a checkup. I'm in medical school. I probably have all these diseases I'm learning about. So I'm a little
That's
neurotic.
That's going to scare the living daylights out of you.
It does.
Learning about all these diseases. It's worse than WebMD.
So much worse.
Because now you're like, oh, wow, I have this.
Yeah, I was like, I have all the things. I need to get a doctor.
Oh, my gosh. I love that. So you already talked about do you specialize in weight loss?
So I did take the boards. I am a diplomat of the American Board of Obesity Medicine.
What in the world does that mean?
Yes.
So how do you focus in these areas and align your broader mission of patient empowerment?
So primary care encompasses everything.
Okay.
But what we are not taught in medical school is much about perimenopause and menopause.
No one is.
Yeah, I know. And
you
weight
guys don't
loss.
even talk about it.
We don't even talk about it.
I mean, it's literally like a 30-minute section in your medical school.
Yeah, and it's written by a man. So it's women go through menopause and perimenopause, and they're going to be hysterical, and your job is just to tell them it's fine and give them an antidepressant and move them along the way.
That is the craziest shit.
No, I know.
I have ever heard. You're actually taught that.
Yeah.
Give them an antidepressant and move along?
Yes. There are times in residency where a male doctor would call up, and say, I have this consult, but honestly, she's just like an hysterical woman, and she's just complaining. And it wasn't until probably 5 years ago I started saying, no, there's something going on here. And so primary care is my bread and butter, right?
Okay.
Board certified internal medicine, that is what I do. I take care of chronic problems, and I take care of all of those things. But menopause and perimenopause and weight gain, they are such an important piece of the primary care portion. So in 2020, I went and I took the boards for obesity medicine just to, I was like, come on, let's do it for real. That was my passion. I will say from a personal standpoint, which I think a lot of doctors end up doing things because it's something that is
near and dear to their heart. Yeah.
I had struggled a lot with my weight most of my life, and I have been told by doctors that my medical problems were due to my weight when they truly weren't. So I had gone through that struggle, and I would have patients come into my office crying. This doctor said they won't do this unless I lose weight. This doctor said the only reason that I'm feeling this is because of my weight, and I don't know what to do, and they don't understand. I tried everything. And so in the weight loss space, which is kind of going through the same changes as the perimenopause space, right? There's so much data. For me, if somebody comes in and let's say they have diabetes, but they are also having obesity, then the question is, how can we tackle both at the same time? Mm-hmm. Let's say that they come in and they have high blood pressure, but they're also having issues with their weight. How can we tackle all that at the same time? Because obesity is a chronic disease.
Right.
And when we treat obesity the way that we treat other chronic diseases, our patients become healthier. And same in the perimenopause space. If we actually treat the symptoms that women are having,
that would be nice.
That would be nice.
Yeah.
And then women can go out and do the things that they want to do and not just sit there every night and go, I don't know, is this normal? Is this the rest?
Is it normal because I can't sleep and I'm sweating and I have night sweats and I'm irritable?
Yes. Is it normal that I'm irritable at everything? Like the coffee maker took 2 seconds to turn on extra today and now I'm angry all day? Not normal. I'm just here to say it's not normal. It's not normal.
That's right. Not normal. That is so funny. We could go on and on.
We really could. We could have a whole separate episode on menopause
and perimenopause because it's a mess.
It's a mess.
And it's the Wild West out there. I do find it there's a breath of fresh air about it because you do have like some prominent doctors online.
Yes.
Dr. Marie Claire.
Yes.
Who's
great.
Speaking about it and trying to educate as much as she can on what is happening and bringing light to the fact that we have to talk about it.
I mean, just like in entrepreneurship, if you look at science, women weren't even studied in science until the 90s. We weren't even in clinical trials until the late 90s. All of the stuff that they are building off of in perimenopause and menopause is stuff that men discussed.
Well, even diet and exercise.
Oh, 100%.
So all of the diet and exercise fads that we hear or say to do were all built on 150-pound man who's 5'10".
Yeah.
Correct?
Yes, 100%.
Every machine you get on at the gym,
Yeah.
that's an automated machine, every keto diet, fasting diet, all those things. And now all the data is showing something totally different. Women shouldn't try to do cardio on a fasted.
No.
It doesn't work.
It doesn't work. We are so different. Our hormone levels are different. Everything in our body is different. We're built differently. There's so much in the weight loss space. Like when a woman comes to me and goes, I work out 7 days a week and I do 4 hours of cardio and I do 3 hours of strength training.
She doesn't eat.
Yeah. And she's like, and I'm still the weight that I was before I started. I'm like, well, what do you eat? She's like, I don't. I eat a protein bar.
Hello.
I'm like, can we talk about real food?
Yeah.
Like real food is delicious. Let's talk about that. It's a lot of, again, that's why I have the practice I have, because these are 45-minute conversations in and of itself. What are you eating? When are you eating? What are we doing? What's going on here? Where are you at hormonally? What do the women in your family look like?
Yeah.
Right? That whole thing. And that's why a practice like mine allows for that.
Mm-hmm. Yeah.
Also, just give women some grace. What about that?
There's always that.
Yeah.
Community, local impact, and philosophy. You're everywhere.
I try to be.
I love it. You're out there supporting the community. You are serving your community, the greater city of Las Vegas, consistently.
Yeah.
And how are you shaping do doctors get together?
We do.
And do you all have the same philosophies?
No.
Oh, interesting. Okay, so the doctors that you're, not necessarily that you have the same philosophies, but are you all aiming to potentially do better for the community? Or some are still stuck in the cog wheel?
A lot of people are still stuck in the cog. So when we graduated residency in 2011, my husband decided to do fellowship, so we were here for another 3 years. And our goal was not to stay. But the more I started working here, the more I realized that we need to stay, because the idea of medicine in Las Vegas is it's the Wild West. You never know what you're going to get. Everybody in this city can say, I've been told if I need care to get on a plane and go somewhere else. That's a common myth, I would say now. I would say since 2011, those of us who have stayed, those of us who are really working hard to build something different, trying to build kind of like a medical kind of entrepreneur, I can go to this person for this and I can go to this person for that, like kind of having that for our patients. We're really, really working hard. But not everybody is vocal about it, right? Not everybody's going to be in that mindset. So me and my friends who are doing this, my colleagues and I who are doing this, we are very vocal about it. We are very vocal about taking care of our patients. We're raising children here.
Right. Yeah.
We need this. Yeah. We need the state. We need the city. We need it to stay healthy because our children are going to be here for a long time, right? We're members of the community. We're part of the PTA. We know other small businesses. So that is really my goal. That's my goal. If I can get out there on a platform and say, hey, Vegas, let me teach you how to keep yourself healthy, or can we talk about this, or, come talk to me if you have an issue, then at least we're making some sort of change, and we're kind of changing what people think of Las Vegas when it comes to the idea of medicine.
Is it changing? Is it getting better?
I think it is.
We don't have a teaching hospital. Is that on the horizon? What is happening on the broader landscape?
So UMC has always been where most of the residency programs are connected with UNLV Medical School. So UMC is a bit of a teaching hospital. We have multiple programs from UMC to Valley to Southern Hills to the HCA hospitals to St. Rose Sienna doing primary care. The key is we get the doctors in there and we make them stay. That's the key. We can train you, but they don't want to stay.
Why?
Because they make their money quickly, and then they are stuck in a cog here, and they can't get out of it because there is still some of that old adage, the doctors that have been here for 40, 50 years, right, that don't really want to change. And so then they move. They move for a better life, or they move, there's not enough housing, so they move somewhere where they can get a job and they can raise their families. But those of us who have stayed are really making a difference. That's literally one of the reasons I take medical students, is to show them what it's like to be what we call an attending doctor, which is what your title is after you graduate residency, right? Like what an attending doctor family can be in this city, and how it is important to stay because we have a growing aging population.
Yes.
And we need people here for them.
That's right. You did mention the traditional primary care limited your ability to truly care for your patients. And how does Coronado Health kind of create that meaningful, sustained connection, right? Sustained
connection. I have about 10% of the population of my patients who have followed me from my very first job in 2011. Yeah. And so now they've grown with me, right? Yeah. They've known me since I've had the kids and gotten married and moved in spaces. That is the sustained connection. The connection is with me, right? I can move my body anywhere. Right. But to me, it's the connection I make with the patient. So case in point, I had a patient who needed something from another doctor. We got it for that patient. And then she sent me a text yesterday just profusely thanking me. And I said, you've known me for this long. You know that's what I'm going to do. I will bend over backwards for my patients because that's what I want a doctor to do for me. Right. I'm just doing for my patients what I would want as a patient.
Do doctors have doctors they see?
Sort of.
Or do you just diagnose yourself?
We diagnose ourselves. I mean, I do have my doctors. They are, they were all my friends first. Yeah, we do. There's certain things like that you can't do on your own. So, we do have to see doctors. Yeah.
You do have to see
Can't
doctors.
do my own surgery. So, I do have to see a doctor for that. Yeah, can't do my own blood draws. But
maybe doctors can. I don't know.
Oh, you don't want us to.
No way.
No way.
That is fascinating. So, do you have any hopes of expanding? I mean, there's only one of you.
That's the thing. There's only one of me. And I've had this thought. I'm 3 years in. I've had this thought a lot. I don't see myself leaving medicine for quite some time. And so the idea of expanding would be not something on my plate right now. People pay to see Dr. Tsui.
Right.
I don't want them to come in and see someone else who's not aligned on the same levels that I am. Honestly, part of the reason I did it so long by myself until I got my office manager is because we had worked together in a previous practice and she was so aligned to me. And so I don't think I'll be expanding, but I am getting so much benefit and reaping so much joy where I'm at that I am expanding in the space of things that I'm doing. So doing more podcasts, doing more lectures, talking to the community, giving myself the time to do that. That's really important to me. Being able to do women's health, being able to do obesity medicine, being able to put together things for my patients that would be really beneficial for them. I'm growing myself as a person, but I don't think I would expand the practice at this time.
Yeah, there's only one of you.
Yeah.
And you're amazing, and people want you.
Yes.
Do you collab? So a patient comes in and she or he has been seeing numerous specialists. You collab with doctors?
Always do. Yep. I'll always get all the records. I love texting doctors and saying, I saw so-and-so this morning. This is what I think. What do you think? We'll collab when they go into the hospital with other doctors. I let them know. I don't have admissions, rights to go into the hospital to do orders and stuff, but I'll tell my patient, I've talked to your doctor, I've talked to the specialist. I always do that. I can do that because I have a small panel of patients. I came from a job where I had 2,500 patients.
Wow.
And now, I have 200 and a little bit over 200. And so, they get that. They get that level of care.
That's important.
It's so important.
How do people find you?
They can find me online.
What is
Coronado Health, Direct Primary Care.
That's your camera.
Oh, so it's coronadohealthdpc.com, or you can find me on TikTok or Instagram at Dr. Harpreet Tsui.
I love that you were here today.
Thank you so much for having me.
People need to look you up.
I hope they do.
People need to I hope this educated people about a few things, right? Truly what you do, the difference between concierge medicine and direct primary care.
Yeah.
And you're just amazing, and you're a badass.
Thank you so much. From one badass to another.
Thank you for being here today.
Thank you for having me.